I have no instructions to reduce the vaccines that we have booked.
Mr. Mitchell, you are in charge of helping to procure vaccines for Jamaica. Are you now considering reducing the number of vaccines you're seeking to have imported into this country?
Well, the NHF is a creature of instruction. So we don't decide on how many vaccines that the country wants. We are told, facilitate this, get this done. I have no instructions to reduce the vaccines that we have booked for delivery.
Which is, how many?
At the moment, it is what is left on our order chart, if you want, is approximately 1.5 million doses of Johnson vaccines, and potentially another 300,000 doses of Pfizer vaccines. That can be it can be changed because we actually can shift the brand in one of those circumstances. In the Johnson order, we could shift the brand if we receive those instructions. At the moment, we have not.
Dr. Bisisa McKenzie, can I bring you in here, though, as the clinician? Given the pattern of behavior we've seen with regard to the take-up of vaccine, should we not be looking at rescoping, re-looking at the orders, and essentially trying to save so many doses from being dumped?
Yes, that is something that we certainly have been looking at, and you notice that Mr. Mitchell has not spoken about any AstraZeneca coming in because we have seen a decrease in the take-up of AstraZeneca, and so we have orders, we have quite a number of vaccines in country. What we are looking at in projection into the future is looking at reduced doses of AstraZeneca, trying to ensure that we have the second doses for persons who have gotten their first doses. So for Pfizer, we have seen that we've had, even though the take-up now is lower, but it is better. And so therefore we're looking more, and as Mr. Mitchell has also said, that we're swapping out some of the vaccines that we would have had on order to try to get the replacement with the mRNA vaccines that we're seeing a better take-up. In terms of the Johnson & Johnson, we have several of those on order. We had anticipated that the one-dose vaccine would have been attractive. We're not seeing the kind of take-up that we had expected, so we're trying to swap out those as well.
So by when will you know that you're cutting down the numbers on order?
Well, we have started to cut down in terms of the different brands. So we're not placing any new orders of AstraZeneca in large amounts, except to deal with the pattern that we're seeing and to ensure that we have the second doses that are in line.